All right, let's jump right in. We're talking about a truly revolutionary piece of medical tech today. But here's the thing. This isn't something that was shipped over from Silicon Valley or Germany. Nope, this is an Indian scanner, designed and built from the ground up to solve a problem that is, well, uniquely Indian.
And that really brings us to the core question, right? How on earth do you design medical technology for a billion people? You see, it's not just about making a fancier, faster machine. It's about creating something that can actually stand up to the demands of serving a billion people in an environment that's unlike just about anywhere else.
So, to really get why this is such a big deal, you first have to understand the problem. Think of it like a tale of two hospitals. On one hand, you've got your typical Western hospital. You know the picture. It's climate-controlled, the patient flow is manageable, the power is always on. And guess what? That's the world most high-end medical gear is built for. But then you have the reality of a public hospital in India. We're talking massive, massive patient numbers, day in and day out. We're talking about crushing heat, humidity, dust, and an infrastructure that, let's just say, can be a little unpredictable. It is a completely different world.
And that right there, that creates this uniquely Indian problem, a situation where just importing the standard off-the-shelf solution, it's just not going to cut it.
I mean, just try to imagine the pressure on these public hospitals for a second. They're serving enormous populations. That means the equipment, like a CT scanner, has to be running practically 24/7. If that machine goes down, it's not just some minor inconvenience. No, it's a critical, life-altering delay for literally hundreds of people waiting in line. And all of this is happening in an environment with so much heat, dust, and humidity that it can absolutely wreck sensitive electronics.
So what's the answer? How do you tackle a problem like that? Well, you don't just import something and hope for the best. You have to build a solution specifically for that grind. And that is the Make in India response. And this is where our story's hero comes in, a company called Sequoia Healthcare. What they did was pretty radical. Instead of just buying a Western machine, this Indian company went back to the drawing board. They started from scratch. They actually went out and studied the day-to-day realities of Indian hospitals and then built their scanner, the Inspiration 64+, from the ground up for that specific environment. Okay, so what actually makes this machine so different? Let's start with a simple number, 75 centimeters. Now, what is that? That's the size of the gantry aperture, the big donut that a patient slides through for the scan. And why does that number matter? Well, what that seemingly technical detail really means is something very human, more comfort for more patients. A bigger opening means people feel less claustrophobic, and it's just plain easier to position patients of all shapes and sizes. It just makes the whole experience way less stressful.
All right, next up, speed. And this thing is fast. A full rotation of the gantry, just 0.7 seconds. That incredible speed means you can do a complete scan of the lungs or abdomen in a single 16-second breath hold. And think about that. It's not just about being efficient. It's about getting a much clearer picture because the patient doesn't have to hold their breath as long, so they move less. And believe me, when you have hundreds of patients to get through in a day, every single second you can save, it counts. A lot.
And this is absolutely crucial. The machine is built like a tank. I mean it. The whole system is engineered to be tough, to be robust. It's made to work reliably day after day in high heat, high humidity, and in dusty conditions. It's all about uptime and having a long, long life, which directly tackles those core environmental problems we talked about. But here's where it gets really smart. The true genius isn't just in the tough hardware. No, the scanner is actually the heart of a whole connected imaging ecosystem. It is so much more than just a machine. So the entire system is built around this idea they call a smart imaging chain. What does that mean? It means from the moment the patient is positioned all the way to generating the final doctor's report, the whole process is connected and intelligent. This is a huge deal for the technologists running the machine. It lets them do scans really fast, and just as important, it lets them do it consistently. So you get high-quality results every time, even when the hospital is absolutely slammed. And this ecosystem solves another massive challenge in Indian healthcare, the fact that there just aren't enough specialists, especially when you get outside the big cities. The solution? It's baked right into the system, unlimited teleradiology. This means the scans don't have to be read by a radiologist who is physically standing there in the hospital.
With teleradiology, those images can be beamed securely to a specialist anywhere in the country, or honestly, anywhere in the world. Suddenly you have 24/7 reporting. You have small remote hospitals getting access to the best specialists, and you dramatically speed up how long it takes to get a diagnosis. This is an absolute game changer for bringing better healthcare to places that really need it.
The system also completely changes how the images get shared. Remember those big, clunky, expensive plastic films? Gone. With digital imaging, the cost is basically zero. There's no plastic waste, and you can share them instantly. We're talking email, WhatsApp, you name it. No more physically lugging a giant film from one doctor's office to another. It's just gone.
And it gets even better than that. A surgeon preparing for an operation or a specialist on the other side of the country can pull up the full high-resolution diagnostic scans anytime, anywhere. On their laptop, on a tablet, even on their phone. Think about the flexibility. That level of access just completely transforms how doctors can collaborate and make those critical decisions.
So when you put all of these pieces together, what do you get? What you get is the beginning of a healthcare revolution. And the amazing part is, it's being driven by homegrown innovation.
And the impact here is so much bigger than just one hospital or one scanner, because these machines are being designed and built in India, in places like Karnataka and the AMTZ Medical Tech Zone. It means the country doesn't have to rely so much on expensive imported equipment, and that makes advanced medical imaging more affordable, more accessible, and it strengthens the entire healthcare system, from the biggest cities to the most remote villages.
Now, I saved maybe the most important number for last. There's this advanced software in the scanner called iDream, and using it, this machine can reduce the patient's radiation dose by up to a staggering 63%. And here's the kicker. It does that without sacrificing any of the image quality.
Let that sink in. That means safer scans for every single person, and that is unbelievably important when you're scanning kids. The system even has dedicated protocols just for children to make absolutely sure they get the lowest possible dose. It's not just smart innovation, it's innovation with a conscience.
So we kind of end up right back where we started. This scanner, this whole ecosystem, it answers that first big question we asked. It shows us exactly what becomes possible when innovation isn't just about copying something from somewhere else, but about deeply, truly understanding the problems you need to solve right here at home.